Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hello there, darling. How are you, Nita Valens?
I am great. And yourself?
Living it up, always.
Well, that's terrific. So our goal today is to actually help our listeners live it up. And how are we going to do that?
Well, we're going to instruct and teach about how to save yourself from having an orthopedic surgery that you don't need. So if you've got rotator tendonitis, rotator cuff tendonitis, meniscal tears in the knee, labral tears in the hip, arthritis in any of the joints, my way of doing this, in my humble opinion, I always say that because I don't want to make anybody angry, it's just my way of doing it, is by injecting PRP, which is platelet-rich plasma, or stem cells into these areas and stimulate new tissue to grow back instead of cutting tissue out and doing something that can be invasive and cause problems. And we hear about it every day, about people who have had surgeries that just didn't work out, that failed them. So if you want to talk to me live right now, and you'll hear about these stories by listening, but if you want to talk to me and give us your input on this and let us know if you have any pain in your body or you have a friend that has pain in their body that's of musculoskeletal orthopedic origin, we may have an answer that works for you. And the phone number to talk to me live right now, write it down, get your pencil. I'll say it a couple of times, 866-870-5752. That's live at the studio. Get ready to write it down and call me up, 866-870-5752. If you are busy while you're listening to this and you don't have time to call in, or you're shy or something like that, just call the office anytime. There's usually people there waiting for phone calls, and they will give you a free phone consult. My staff will do that. And the phone number there is 800-300-9300. Good phone number, huh? 800-300-9300. And I have an amazing website. It's all full of research. Research means studies that are done. And we've done research in our office also. You can look at a menu button on our website that says research. But all the articles are really research articles. There's so many pages of actual scientific information. And the website is www.jointrehab.com. Jointrehab.com. And there's also a spot on every page to email me, so you can email me directly right from that website, which is www.jointrehab.com. If you call in, or if you let me know that you exist some way or other, I will mail you out a free copy of my book, Stem Cell and Platelet Therapy, and the byline is so important: regenerate, don't operate. That means heal the tissue, grow back tissue, stimulate more tissue to grow back what's been injured or worn down with arthritis. And we inject all over the body. Dr. Thomas Grove is our new injector, and he is amazing. He played football at the Cornhuskers in Nebraska. He was a linebacker. He's a big, strong dude, works out twice a day, and he is fun to deal with. He's got a great personality. He's a very kind person, and he's really pretty much of, on how to put it, like a genius. He's an intellectual medical genius. He knows everything about medicine. I try to stump him all the time, but it doesn't work. And he's a great injector. He injects with ultrasound guidance. And if you're getting injections without an ultrasound, you're going to the wrong doctor because you can't see where that needle is going. Actually, I'm just flashing in my book right now, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. On page 47, there's a photograph of me injecting a knee under ultrasound guidance. And the studies show if you don't use an ultrasound, you're going to miss the spot at least more than a third of the time. So what's the point? What's the point of getting an injection if the proliferative, the solution that's going to help heal you, is being put into the wrong spot? I think this is an amazing book. It's a couple hundred pages long. It took me 5 years to write it. And it has 250 studies in it, scientific studies, peer-reviewed studies about how platelets and stem cells can heal the body and how surgery can fail you and cause you problems. So I'm showing a picture to the video camera right now on page 67 of the book of a back fusion using pedicle screws. And if you saw this, you would never have this done. There's great big pieces of metal and these big screws that are screwed into what's called the pedicles in the back of the spine to hold the spine together. Yeah, it's terrible. And the problem is the area that's fused can feel better sometimes for a while, but the area above the fusion and the below the fusion breaks down because then there's double or triple or quadruple the pressure there because of less movement in the fused area. So that's sort of, to me, a very dangerous kind of a surgery to do. I know there's tons of them being done. I'm not a fan of surgery. I was when I was in medical school and residency, and I was very interested in becoming a surgeon until I had a surgery on my shoulder by my boss that, he was a great guy, he was a great surgeon, but it failed me and it made my shoulder much, much worse. And it wasn't until 4 years after that surgery, 4 years of misery from the surgery, that I injected my own shoulder with a proliferative, what we call today regenerative medicine, and healed my own shoulder overnight. So I'm not telling you that this is a magical cure using platelets or stem cells, because it isn't. It just makes sense. If you put cells in that stimulate tissue growth, you're going to get tissue growth, and hopefully from that, pain reduction or elimination. It doesn't work on everybody for many different reasons, but it's worked on me all over my body. So I'm really a fan, and I've watched patients. I've been doing regenerative medicine for over 25 years. Dr. Grove's been in this field for a dozen years or so, so he knows what's going on also. So I don't know why people get surgery when they don't need it. I really don't. It's sort of our culture to medicate and to operate, and it's changing now that people are learning about this. More and more doctors are learning how to do this, but it still is not the forefront of medicine, so you have to kind of go outside the box to get your healing, but it's very conservative. Basically, walk in the office, get injected, and walk out. You don't need anybody to drive you. You don't need anesthesia. I can't think of any terrible side effects. There could be if you have someone doing it who doesn't know what they're doing. If you're injecting a back or neck, you need to make sure you're not going near the spinal canal, with the spinal cord, or the like in the neck, the vertebral artery, things that can really hurt you. And those things do happen by people who are not qualified, so be careful. Like any other doctor, always go to the doctor who does the most. So I'm going to give out the phone number again. Give me a call live. I'd love to talk to you and answer your questions. If you're shy, just say it's your mother you're calling about, or your sister, or your friend, or something like that. And the phone number to talk to us live right now is 866-870-5752. That's at the studio. 866-870-5752. And if you want to catch me at the office, actually you'll be talking to my staff at the office. They'll give you a free consult over the phone. That's 800-300-9300. 800-300-9300. So, Nita, I hear you hustling around there. Is there something you want to tell us?
Well, I just want to remind people about what you said a few minutes ago, to call the program and get the book, because the book is amazing. Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And we're trying to spread the word about a new paradigm, and it's hard to let go of old ideas. And I realize that's true for all of us.
Well, it is true. And, human beings, and you're a psychologist, you know this as much as anybody. I was a psych major in college. I
never knew that.
Yeah, I was a psych major. I loved it. And I love philosophy, and all of that, too. Philosophy was hard in college for me, though. I didn't do that well in it. I didn't quite get it back then. But today I really love it quite a bit, and I spend a lot of time reading the great philosophers. And I've had, as you know, I've had a spiritual teacher for, 51, 52 years now. And I've studied. It's really an all-day study. Once you learn the precepts of how to think correctly, and I'm not any master at it. I don't know if anybody is, but it's something to work at. And what it comes down to really is just having a good heart. Doing the best you can do, and not judging other people because they're doing the best they can do also, hopefully. So. I'm going to go to, Nita, I'm going to ask you a funny joke.
Oh, I thought you were going to go to an email.
Well, I can do that too. Where does the general put his armies? In his sleeveys.
I did not even hear the answer, sorry. He did what?
Okay, where does the general put his armies? In his sleeveys.
Okay, I heard it now.
Well, being a
funny.
great golfer like you are, I know you'll get this one, because you get a lot of hole-in-ones. Why did the golfer bring 2 pairs of pants? And I already gave you a hint.
I have no idea.
In case he gets a hole-in-one. Do you know what a hole-in-one is?
Yes. I have never golfed, but I do know what that is.
Well, I've been golfing. I don't golf a lot, but I usually golf every weekend for 9 holes at least. And a hole-in-one is it's almost like a mystical kind of experience, because you're hitting a ball from, maybe 215 yards or less to a green, which is small from way back there. And the cup, as they call it, is very small. And when it goes in from that far back, everybody around gets excited. In all my years of golf, I've had 2 hole-in-ones, and one of them was from a ball that I sliced into a tree next to the green, which slice is not a good thing. It means it went a banana peel right.
Ouch.
Yeah, it's when I first. I was maybe 15 or 16 years old. I hadn't played golf, but I went out to play, and I just smacked the ball as hard as I could, and it was an errant shot to a tree, and then I didn't see this happen. I took a walk, and I was looking for the ball in the woods, and there's some guys on the green, and they said, "What are you doing over there? Your ball is in the hole." And I said, "That's impossible. I saw it go into the woods." And they said, "Yeah, we did too." And it bounced off a tree and bounced into the cup. So it still counted. That's a hole-in-one. And then on a Wahoo Country Club in 2014, I was playing with a med school buddy, and it was a 215-yard shot. I took a 5-iron and hit the green, and it hit the right side of the green. The hole was in the middle. And I thought, oh no, it's going to bounce off into the sand trap, but nope. It took an amazing bounce to the left instead of the right, where it should have gone, and it slowly inched its way over to the hole, and boop, went right in. The worst part about the story, you want to hear it?
Yes.
At this particular country club, if you get a hole-in-one, you have to pay for drinks for everybody at the club.
Oh, no.
So
How many people were at the club?
There were a lot. I said, what'll it cost me? They said, probably about $2,500.
Oh, my gosh.
So there is a thing called hole-in-one insurance, which I didn't have.
Oh, wow.
Because I never heard of it before. So I very stealthily left the golf course.
Did you ever go back?
Well, they didn't remember me. All right, so let's go to some questions here.
Okay.
I'll give out the phone number to the studio now to ask your questions about your orthopedic pain and how to save yourself from getting a surgery. The phone number to talk to me live right now, give me a call, 866-870-5752, 866-870-5752, and I would love to speak to you and see what your issues are and see if we can save you from having a needless surgery. You don't want to have a surgery that you don't need. And be very careful, because if you go to several of the same type of doctor, you're probably going to get the same type of opinion. So if an orthopedic surgeon says you need a surgery and you go to another orthopedic surgeon for a second opinion, you're not necessarily getting a second opinion. You're getting the same opinion from a different doctor. So be careful. Okay, so this is, let's see, patella osteoarthritis. So the patella is the round bone in front of the knee, and it slides in the trochlear groove of the femur. You can look up these terms on Google if you're near your computer while you're listening. And in the upper left-hand corner, there is a little menu button that says Images, and you can click on that and you'll see photographs or drawings of what these things are that I talk about anatomically. So if you have one of them, you can see what's going on. Because most patients, when they come in, they'll give me a diagnosis, and I'll say, do you know what that looks like? And they'll go, no. And then I'll crank it up on the computer and show them. They go, wow, I didn't have any idea that's what it was. So patellar osteoarthritis. This person says, I have debilitating arthritis behind the patella. Can you help me? So the word debilitating to me is a term of drama. I don't know what debilitating means. It can mean something different to a lot of different people. So it's not really a medical term, but it means the person is certainly not happy with their knee. And arthritis behind the patella often can just cause some pain. Sometimes it can cause decrease in range of motion, and sometimes it can just cause complete misery. So this is the case, like really every other case that I see. I have to examine that person, or Dr. Grove has to examine that person and see what is going on. We don't treat or diagnose based on images. So there are people that have terrible arthritis, they're told by their doctor, called bone on bone, and they have complete function and no pain. So why would you get a diagnosis like that? It's backwards. You want to do an examination, and as many people who have had surgery will tell you, the surgeon never examined them. They looked at an MRI or an X-ray or CT scan and told them they need to have surgery. That happened to me with my shoulder. There was an MRI done when I had some pain back in med school, 4th year of med school. Went and I had an MRI. The doctor said I had impingement syndrome, and I loved the doc, but he shaved down the acromion, which is the bone on top of the shoulder, and cut some ligaments, and I came out much worse than I went in. My arm was full of fluid, I had a fever, and I never regained my range of motion of that shoulder. It was much worse after the surgery than before, until I injected it myself and healed it. So be very careful when you get a diagnosis that you don't go ahead and have a surgery, especially if the doctor doesn't examine you to find out where the pain is being generated from. We call that the pain generator. And Dr. Grove and I talk every day about our patients who have failed surgeries, who were operated on the wrong area because the surgeon never touched the body. I'm not putting surgeons down. Believe me, I love surgeons. They do very difficult, kind of scary work. There's a lot of doctors who started out to be surgeons but freaked out about the dangers involved and never did it. I used to love going into surgery. I thought it was like the most fun thing there ever was. But after the shoulder surgery, I was like, I'm not going to do that to people. And I was very fortunate. In a sense, I was fortunate to have injuries that I was able to heal by injecting myself and realizing that surgery is often not the answer. Often it is the answer. If you have a broken bone sticking out of your leg or something, you better get right to the surgeon and have that put back together. But most of the cases that I see are non-surgical cases who have had surgery, which is not a great thing to do. People coming to me after a failed surgery, one where they didn't get any better or they actually got worse. And then regenerative medicine using PRP, platelet-rich plasma, or stem cells can often heal the area that never needed the surgery to begin with. So if you're going to an area like the knee, here with this person saying they have debilitating osteoarthritis behind the patella, that may not be the cause of their pain. Okay? Things can look like arthritis on images but not really cause a problem. I've had people with full range of motion, no pain upon examination, and their image shows arthritis. And what is arthritis? Arth is joint, itis is inflammation. So it's inflammation in the joint. It looks differently on different images. It can be bone that's hypertrophied or grown. It can be worn down cartilage. It can be many different things. But I have so many people come in who say, my surgeon told me I've got bone-on-bone arthritis. I have to replace that joint. And I move them around. And I go, does this hurt? They go, no. And then I'll find a spot close to where the joint is, but it's not the joint that's causing the pain. Inject that with a proliferative, PRP or stem cells, and heal it up. So be very, very careful not to buy a surgery you don't need. And the silly thing is a lot of people will say, I'm going to get surgery because I don't want to get injected. I don't like needles. Well, guess what? You're going to get needles with surgery too. And then people say, I'm just going to go to surgery because the problem will be over then. A lot of times that's when the real problem just begins. And then a lot of people say, I can't afford to do regenerative medicine, so I'll just get surgery because my insurance pays for it. And guess what? The surgery didn't work out, then they've got to go spend a ton of money on other things. They can lose their jobs. They can, just a whole myriad of things that can happen after a failed surgery and expenses that you never thought would happen. So you got to be very careful. There's enough information today on Google and the rest of the internet where patients need to do their homework. They need to do more than just listen to their doctors, because medicine is, traditional medicine to me is for dinosaurs. You got to look ahead, see what's coming up, see what's new, see what can heal you. There's not a day that doesn't go by that I don't look on the internet for new medical ideas. And I've been doing medicine for a long time. But there's always new things coming up. And you owe it to yourself to find out. Oftentimes, you can take a lot of my patients come in, they're taking like 5 or 6 or 8 different medicines. And I ask them, what's this one for? And they go, I don't know. I go, how long have you been taking it? 15 years. Why are you taking it? I don't know. My doctor told me to take it. I look at them. I'll look at their labs sometimes. I go, you don't need that medicine. And they say, should I stop? I go, nope. You got to have the doctor that gave it to you tell you what to do. I don't butt in on other doctors. Anyway, give us a call. We're going to break. We'll be back shortly. And the phone number to the studio is 866-870-5752. Give us a call. We'll give you a copy of my free book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Actually, it's not a free book, but for you it will be free. And I'll pay the postage.
Yay. Okay, we'll be right back after this.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.